The Christ Katy Clinic is a non-profit clinic that serves the uninsured and underinsured in Katy, Texas with acute and chronic care needs. The Christ Clinic began in 2000, one evening a week as part of the Memorial Lutheran Church. What started as a small operation are the gymnasium of Memorial Lutheran Church in Katy has grown to a non-profit organization with more than 50 volunteers that treats an average of nearly 2,000 patients a year. The Christ Clinic moved to its First Street location in downtown Katy in 2006, after more than 5 years of operating at Memorial Lutheran. The organization has since expanded its services to include prevention and chronic care, free or discounted immunization, and health and nutrition classes.
Okay, so, tell me the history about Christ Clinic Katy.
So Christ Clinic, our history is that we began as a part of a church. The Memorial Lutheran Church in Katy saw a need for medical care, and there wasn't anyone else providing that need in Katy. So they started seeing patients out of the church gymnasium in 2000, and they operated in the gymnasium until about 2006. And they saw patients one night a week. And then when they moved over here in 2006, they were able to expand and start seeing patients about 3 times a week. And from 2006 up until last year, we still operated as a part of the church. And then last year, we became our own 501c3. So what I really tell people in the community is we have been serving the community for a long time, but we are a baby organization as our own and independent of the church.
What are some obstacles that you face, while working here?
So Christ Clinic is a charity clinic, which means we get no federal funding to keep us sustained. We have to depend on community support, individuals, some of the churches, and local hospitals. And so our biggest challenge is being able to fulfill the need in the community on the limited resources that we have. So because the need is so great and our hours of operation are not full-time yet, our biggest challenge is to be able to try to expand and grow the meeting needs of our community.
How's the community responded to the Christ Clinic?
Well, because we were a part of the church for a long time, there was limited exposure to the rest of the community. But as I have, as we are all working more to promote who we are and what we do, we are getting a great response from the local churches that want to start supporting us, that haven't supported us in the past. We are challenged because one of the #1 philanthropic sources is individuals, and we have small individual support, so we need to grow in that area, and we're challenged by that.
In your own words, what does the Christ Clinic do?
What do we do?
What does it mean to you?
What does it mean to me? I am passionate about serving the most vulnerable people that are living and working in our area. So for me, what we do here at Christ Clinic is helping people that really are extremely vulnerable medically and economically, and that if we weren't here, these people would have very few other options and probably end up in the emergency room, and the cost that our community would have to pay for that is much greater than serving people here.
In 5 years, where do you see this place?
We actually just implemented a strategic plan. So in 5 years, we want to be the place that that the most vulnerable people can come to get their medical needs met. We want to be known in our community for high quality service and easy access for our patients.
Okay, that's it. Thank you.
Okay, thank you.
The clinic is staffed by paid and volunteer medical staff and assistants to provide care to those in greatest need. All the services offered at the clinic are health-related, ranging from medical visits, pharmacy assistance, on-site labs, and health education classes. The Christ Clinic extends the healing ministry of God by offering high-quality healthcare and health-related services to those who are uninsured or underinsured. Quoting, "We serve those in need with love, compassion, respect, and dignity by utilizing a team of caring volunteers and staff." A recent partnership between the clinic and Katy ISD's Miller Career and Technology Center will offer a volunteer opportunities to the Katy ISD students taking certain courses.
So what have you learned while working in this organization?
While working with this organization, I have learned that there are an incredible amount of people who really care for the community and to help others. In this day and age, it's something that's very rare, and it's amazing to see how many volunteers, physicians, front staff, everyone that comes and helps the patients for the common good.
How do you feel while working here?
When I come here, I love it. It's amazing that I get to see firsthand how we're helping the underserved populations, of people who don't have insurance, that there actually is somewhere where they can come and get the best health care out there for a low cost. The patients are offered medications, follow-ups, referrals to good physicians. It's just amazing the list of things that they can come when they get to this clinic.
What are some reactions of people who helped?
The reactions that they give are just they're really thankful, they're really grateful people when they receive the health care that they get here, their physical exams and their medications. They're just really grateful, and it's really nice to work with people who want to get help and who want to get better. You know, they stay out of the emergency room by doing the things that they learn here, do like diabetes and education classes. So,
What are some hardships you face at the clinic?
from a healthcare provider perspective, some of the hardships that have been faced is medications. For instance, if a patient can't afford a certain medication, it's difficult to have to go look up another type of medication that they can be able to afford. So that's a little bit difficult, but we definitely try our hardest to be able to get medications that the patients can either get for free or that they can get at a low cost. So that's a little bit difficult from a healthcare standpoint.
How has the clinic changed from the day you started working to today?
The clinic has changed in a great way. I see more and more volunteers coming in and out of this clinic, which is really great. They help us triage patients and educate patients. So I've seen more volunteers come through here, and a set of volunteers actually helped out to get us tile floors in our supply areas. So that's amazing. They went from carpet to nice tile floor. So that's definitely been a good change. So mostly good changes I've seen.